Come back, guys, for the other parts, which is the accessibility here in the accessibility in the healthcare system, the Canadian healthcare system. Accessibility in the Canadian healthcare system. Like you see here in front of you, accessibility in the Canadian healthcare system. What the accessibility is a principle of the Canadian Health Act that states that the people must have reasonable access insured healthcare services. So it means that the people will have healthcare services. Everybody has access, means is not forbidden, is not prohibited from having healthcare services. This is the meaning of it. Actually, this is the meaning of it. So people can receive medical necessary services regardless of their income, age, health status, gender, geographic locations. In all the cases, people can receive health. People can receive medically necessary services like those which is health cover. So they can receive the health cover. Accessibility by Canada's healthcare system, including provincial and territorial plan, ensures that all insured people can visit hospitals and see a doctor without any financial burdens. So this is the accessibility in the Canadian healthcare system. Okay. Once more, there is difference also between the healthcare system and between the privatization. Privatization is transfer of ownership or control of public sector's companies, enterprises to a private sector. So this is the meaning of the privatization. I will move from public sector into a private sector. Privatization again is moving from public or governmental sector into private sector. So this is some points about the accessibility. Okay. If there is advantages for the accessibility, yes, there is advantages for accessibility. Accessibility, we said, the right to have a cover, medical coverage by the insurance. Like as example here in Ontario, they call it OHIP or Ontario Health Insurance Plan. So here, the advantage of the accessibility, the first thing is the eligibility. All Canadian citizens and permanent residents are eligible for the health care. They are all eligible for the health care. Range of services. So the range of the system covers medically necessary hospitals and physician services. However, coverage can vary slightly from a province to another province. It can differ from a province to another province. Low income supports, the system is designed to ensure that the people with a low income support and families can access necessary health care without financial barriers. So even if they don't have money, they still can enjoy they are still eligible for the healthcare service. The 4-point indigenous, those are the original people. Indigenous health, indigenous population often face additional barriers to accessing healthcare, but the government, in partnership with indigenous organizations, is working to improve the healthcare services applied for the indigenous people. Public funding, the system is funded through taxes collected by federal and provincial and territorial governments. So the OI plan is funded through the taxes, and we talk about this in the start of the curriculum here. We said that the taxes goes part of it to cover the health insurance. Either regardless of how many provinces are doing, all the provinces are doing this. All the provinces are doing this. Out-of-pocket expenses. So this is advantages of accessibility. It's out-of-pocket expenses because you might not plan for it. You might don't save money. So, okay. While essential services are covered, individuals may incur out-of-pocket expenses for services not deemed medically necessary. such as dental care, vision care, vision care, and physiotherapy. Many Canadians have supplemented private insurance to cover these costs. So this is the things like the dental care is part of it is out of the health insurance. So you can do this by your own money, on your own money. But not some services are not included in the health coverage plan. The challenges of the Canadian healthcare system, a long waiting time. There is dispersion based on the geographic area because Canada is a very large country. While Canada has a universal healthcare system, access to healthcare services can vary significantly depending on where people live. Remote and rural areas, and so on. Because Canada is very large, the second largest country in the whole world from the area. The area of Canada is the second one in the whole world. Mental health services also. Access to mental health services remains a challenge in Canada with long wait times for the care and a lack of resources for the community. So mental health care also is having some issues here, and this is one of the challenges of the insurance plan or the OHIP. Okay, despite these challenges, the Canadian healthcare system perform exceptionally well in terms of accessibility as it strives to ensure good healthcare services for its population. However, it's essential to continue monitoring and improving the system to address any issues to improve the Canadian healthcare system. That was the topic which we want to talk about. The accessibility means everyone has the right to be medically covered. Yes, the health insurance plan is not covering everything, but at least it's covering the main points or the principles. Chat in the next part.